This is a movie presentation about restless leg syndrome. Restless leg syndrome, also known as Willis-Ekborn disease, is a common sensoromotor disorder that may be idiopathic or secondary to a diverse group of conditions. The pathophysiology is only partly understood, but a strong association can be found with brain iron deficiency, possibly resulting in impaired dopaminergic function. Restless leg syndrome symptoms can be found nearly twice as much in women than as of men. Data from a study has found that 9.0% of women and 5.4% of men had experienced restless leg syndrome symptoms within the previous year. Secondary restless leg syndrome is often associated with renal insufficiency, pregnancy, iron deficiency anemia, diabetic neuropathy, and Parkinson's disease. Approximately 1/4 of pregnant women experience restless leg syndrome, with more intense symptoms experienced during the third trimester. Several hormonal theories have been suggested, including the possibility that an increase in prolactin, which is associated with the lessening of dopamine activity, is responsible for restless leg syndrome symptoms. Other potential associations of restless leg syndrome are end-stage renal disease as one of the most common comorbidities associated with restless leg syndrome. Other conditions linked with restless leg syndrome include Parkinson's disease, congestive heart failure, neuropathy, depression, and sleep apnea. It is also clear that, at least in some cases, restless leg syndrome is inherited. A hereditary link study by Winkelman and others involved 300 restless leg syndrome patients, 232 with idiopathic restless leg syndrome, primary restless leg syndrome, and 68 patients with restless leg syndrome secondary to uremia. The authors observed a definite family history of restless leg syndrome defined as at least one first-degree relative with verified restless leg syndrome in 42% of idiopathic restless leg syndrome patients and 12% of patients with restless leg syndrome secondary to uremia. The International Restless Leg Syndrome Study Group has produced diagnostic criteria that are generally considered the standard for restless leg syndrome diagnosis. 4 essential restless leg syndrome criteria describe an urge to move the legs, typically accompanied by uncomfortable paresthesia-like sensations in the legs. The second essential criterion for restless leg syndrome is that the patient's symptoms will become exacerbated or more with inactivity or resting. The third criterion posits that the movement, urge, and accompanying sensations are relieved when the subject engages in movement. The relief from the symptoms will normally occur immediately or nearly immediately after movement is initiated, and will endure so long as movement continues. In many cases, however, symptom relief due to movement may not be total or may be accompanied by a sense that the symptoms will return after the cessation of a movement. The final criterion for restless leg syndrome states that the urge to move and unpleasant accompanying symptoms are at their most intense at night or in the evening. This supports the second essential criterion that the sensations and the symptoms from restless leg syndrome will become worse with inactivity or resting. It is still not completely known what causes restless leg syndrome, but there have been many arguments as to what does cause restless leg syndrome and what can help it. One of the most persuasive arguments in favor of dopaminergic dysfunction is in striking improvement in symptoms with dopaminergic drugs. However, the mechanism of this improvement has never been fully proven. Iron deficiency has also been repeatedly shown to be associated with restless leg syndrome. Some of the secondary causes of restless leg syndrome, being end-stage renal disease, iron deficiency, and pregnancy, are all associated with problems maintaining adequate iron. However, the mechanism by which iron deficiency leads to dopaminergic dysfunction is unclear. One of the challenges of evaluating the role of iron deficiency in restless leg syndrome arises from the fact that serum iron levels are highly variable and can be impacted by a variety of confounding factors such as circadian rhythms, sleep disturbances, diet, and other lifestyle factors. It's been hypothesized that serum ferritin, a protein that stores iron in tissue, might be a more clinically appropriate means of measuring and understanding the role of iron in restless leg syndrome. A study was done to see the role of ferritin and iron, and it was found that patients with restless leg syndrome had a lower amount of iron and ferritin, but a higher level of transferrin. The higher transferrin levels indicate greater requirements for iron in the brain. Subjects with restless leg syndrome also experience significantly longer sleep latency, less sleep efficiency, and a higher PLM index. There are many approaches to the treatment of restless leg syndrome, including both pharmacologic and non-pharmacologic therapies. Although additional help may be needed to help with restless leg syndrome, there are other things that a person can do to help promote healthy sleep. Some of these things are not smoking before bedtime, limiting caffeine intake before rest, limit stimulating activities before bedtime. Try to keep it so that the bedroom is for sleeping and resting, while the living room or den is for watching TV and other activities that promote being awake. This would include leaving the TV in the living room. The TV from the bedroom can also promote sleep. If restless leg syndrome seems to be adversely affecting your life or your spouse or partner's life, it is best to seek advice from your doctor. There are medications that help with the management of restless leg syndrome. If left untreated, it may cause you to be drowsy the next day or irritable. It may also cause your spouse or partner to be irritable.
You're ruining my beauty sleep. Go sleep on the couch.
Medication to assist with restless leg syndrome are dopamine agonists, as they have for some time represented the mainstay of restless leg syndrome therapy and are employed in all categories of restless leg syndrome. Another medication to treat restless leg syndrome, levodopa or carbidopa, has a rapid onset but relatively short duration of action, even in its controlled release formulation, making it most appropriate only for intermittent symptoms. If you feel you need medication for restless leg syndrome, it's best to contact your doctor to see which medication works best for you. I would like to give credit also to Kapil Sethi and Shyamo Mehta, who wrote a report, a clinical primer on restless leg syndromes, what we know and what we don't know. Much of the information given in this report was received and learned from the report written by these two individuals. I'd also like to give credit to The Fundamentals of Nursing, 7th edition by Taylor, Lillis, Lamone, and Lynn, published by Lippincott.